electronic prescription leaflet initiative has the potential to disrupt the pharmaceutical supply chain, we believe, in a very good way. We've been working on the e-Leaflet initiative with a number of different partners, as I said, for about the last 15 months. And I'm going to turn it over to our Director of Business Development, Swami Subramanian, to take you through some of our progress. Swami?
Great. Thanks, Sean. I know let's quickly go through the update and welcome you all. And it's a time to get the updates on the e-Leaflet. So the reason we start as Axia is a value chain innovation center. We work on all the value chain challenges across the industry. And this particular problem is a e-Leaflet. This originally brought to us by one of the manufacturer. Then we realized it's not just the one particular stakeholder's problem. This is a value chain problem across the industry. And Holly, next slide. Then we we discussed with multiple parties and stakeholders, manufacturer, distributors, even healthcare providers. And we realized the problem should be addressed. And actually started working on an electronic IoT assisted leaflet idea. And so it's really taking the next level of the current today, how the patients are taking their drug information. And one important thing is the patient should be able to access the drug anytime, anywhere across. So that is one theme, and that's how the entire problem been visualized. And next slide, Holly. And once again, thanks to FK, Lilly, Johnson & Johnson, and the solutions provider here. So we are closely working with them to understand the problem and also visualizing how we can come up with a better solution to really address the challenge. And we are talking with the multiple other parties from a manufacturer, solution provider, to really make it as a bigger impact to the community. Next slide, please. And this is overall, yeah, tap it like go till it's go to the next. Okay, yeah, stop it. And this slide shows the overall roadmap, certainly the aligning with the stakeholders, then a framework development, then focused on how are we going to demo this pilot work and do the program. Then it's finally execute the pilot and gather the data, then how we can use the data to make things work. So this is really our roadmap. And Holly, next slide. And so since the beginning, August 2023, we started, and you can see the bottom graphic shows how we started working on it, understanding the customer wants and needs through customer discovery. Then we started inquiring that, so what is the value proposition across the different stakeholders, from a drug manufacturer, solution providers, distributors, even a healthcare provider, hospitals, and patients. Then we wanted to validate those. That's before getting into the solution. So that's how we progress into the solution, pilots, and execution. You can see multiple meetings being laid out from since 2023. And we are constantly going through and reaching our stakeholders and making sure we are gathering enough information and we are making a decision based on the data. And we are in October 2024. That's almost we have completed most of the validation portion and we are moving towards the solution space. Next slide, Holly. That's said one of the process is validating a value proposition. And before that, we gathered this information through multiple interviews and also it's surveys and everything. We gather what would be the real value proposition. From a patient perspective, that is important because the entire program is constructed based on a patient-centric solution. What is their major pain point is a pattern. I use my cell phone to take the picture of the drug information and zoom and read it. And if this is my case, what about someone in a household? They miss the pamphlet, how they know? So this is a basic patient. Then from a drug manufacturer, certainly it's a printing. Then also if there is a recall, then if there is even a typo in the leaflet, they have to recall all the drugs. So that's such a bigger pain. From a distributor, the loose and leaflets, which is really creating an inefficiency. it's impacting their automated system. So it's most of the time they say like a 30% it's being problem. Then it's a pharmacies, of course, they always get the more information. The patients are asking more information. So all these as general problems are standing into the value proposition as a benefit if we address it. So next slide, please. And as I beginning mentioned, it's a patient-centric solution, but having in mind with all the manufacturer distributors, how we can bring the savings or how we can get more data to really make more informed decisions. So that is a four major metrics as a patient-centric, a digital connect, usage data, and savings. These are the key metrics lying behind the e-Leaflet program. Next slide, please. And in the process, again, when we hear all the value proposition, then we want to make sure, is it the right? Are we doing the right thing? So we have conducted a survey to validate our value proposition. This slide shows like really how many people wants to read their drug information through a cell phone or something electronic way. The left-hand side shows in US, in general, 80% of the 85% of the population like to read through a electronic way methodology, and 6 to 7% is really they do not like it. I mean, it's understandable. Maybe a situation differs. And in the similar left-hand side, the bottom, even it gives the detail from a West Coast to East Coast, really how people, it's a general trend as 85% of the people prefer. And if you go to that, really why they want to read, why they want electronic, that is a major pain point. You can see there is a top 3 as listed here. It's very tiny to read. It's too complex, more technical, unable to find what I want. So these are the things that are a major problem, as we all know exactly, but we wanted to validate through a survey. So these are the survey's results. This from the understanding, nearly 85% of the population, they are struggling to a current paper pamphlet. So how we can give enough information, a patient-friendly or caregiver-friendly. Next slide, please, Holly. Then even a one level down, we went to see like from an age group, how can we see? The right-hand side, it talks about the age group. You can see below 25, people don't care about the call center. Usually the toll-free number, because that's the youngest generation. Whereas but in overall, people are like around 25%, 30%, they prefer a cell phone, electronic, or maybe QR code. So general, there's a trend going on. And from the left-hand side, you can see almost like 25% of the people, they really are, most of the, whether it's emergency, like ER drug, or maybe like over-the-counter, everywhere the 25% of the people are really using the pamphlets. And this is a behavior. So we wanted to make sure, are we addressing the right problem for the patient? So these data, we did through a third party, and we got enough information. This helps us to move forward. Next slide, please, Holly. And we are getting into the now solution space as a majorly the minimum viable product that comes in the 2 layers. The first layer is a simple digital solution. Then this digital solution is an immediate thing, but really the 5% of the population, or maybe 6 to 7% I mentioned in the beginning, the one of the couple slides back, they need a paper pamphlets. How are we going to really help them? So that is a stage 2. There is a print on demand. It's a paper leaflet solution. So we are coming with the 2 stages. And next slide, please, Holly. So the stage 1 is going to be a digital drug information. Yeah, patients can access, or the caregivers can access, or the healthcare provider, or doctors, or the pharmacists, anybody in the ecosystem, they can access the drug information through a simple cell phone tool. The tool is going to really, as long as they scan their NDC code or EPC code, and today I'm going to do a demo, a little bit even an advanced futuristic thing. So even they no need to enter the information. So this is like a one-click, one standard app across the all industry, whether it's a Pfizer or Lilly or J&J or Sanofi or Apotex. The consumer, the end user, they just one app, they just use and scan and get the drug information. So that is our vision. And in that, then stage 2, it's a print on demand. When the patients or caregivers needed a printed pamphlets, the solution there will be a self-print, like a self-station, self-supporting station will be some of the location in every city. Then the patients or caregiver can walk across. Even the particular person from Texas can walk into the Michigan to the some of the station. They can print. So that's kind of a really anytime, anywhere across the US, they should be able to access the printed information. And this really try to support not only the 7% of the population, also if somebody needed an emergency, they want to read something critical drug, this solution is going to support them. Next slide, please, Holly. And that's kind of the print on demand is mostly downshifting the printing cost from the upstream to downstream. So it's going to really save like huge millions and millions of dollars for the manufacturer. One more next, so you will see that. And so right now, the left-hand side shows the IRX, that is the Axia has developed our app. This should be able to scan the particular drug, and it's fetching all the data from the FDA, and it's giving all the drug information as a patient-friendly. But this is a demo. It's a very early, like a beta level. But the futuristic, it's going to really bringing more relevant information, for example, like a ADR, adverse drug reactions, or maybe like it's going to be connecting with My Health, or even in a one level further as a futuristic, we are thinking as being in an academic world, we are thinking what is the future? It could be a voice integrated system. If somebody use the voice to really get the drug information, all these things. So with that, we will be going to the next slide, the IRX demo. That is the reason actually I kept my background always without a digital screen. And today actually we have demo. We have a couple of drugs, and thanks to Identity, because just I'm doing showcase, but this particular effort. Today our demo is going to be how we can get this, like even no need to enter the IRX apps. You can enter the NDC or the UPC code, but Identity, they helped us to get. So thanks to the Identity team with this RFID tag. So simply when we tape on the cell phone, it should be able to detect the drug information. So with that, actually, first I'm going to take this drug, and I'm going to share my screen also. So you'll be able to see how really it works. Screen. Okay, so here. Okay, it takes some time. Okay, so my cell phone I'm sharing from here. So I have the drug container, which has an RFID tag. With that, technically we have an IRX website, like there is a app, web app. Then when I tape this, then you can see automatically it takes into IRX, the demo app. And here it detected the drug information. I give an accept language. So I click accept. Then it detects the drug. This is directed from the FDA information. Then you can see it's collecting the data from the daily med, and it's showcasing all the information as a patient friendly. And this is something very early stage. Certainly, we are going to bring more innovation in this to make the digital platform as more usable and better accessible. And you can see this is like a Apotex drug. Kind of, so it's technically the IRX app is capable to, you can see there is I can go and manually enter the NDC, National Drug Code, or even it's capable to scan. That is, I can go ahead and scan the barcode. So all the features are available in IRX. The real thing is how we can make it more patient friendly. So that's what Axia is doing. And this demo is like how we can futuristically use the RFID tags. It's a dual frequency tag. So technically it could be used for, it's a patient centric. Also, it could be used for a supply chain, those kind of thing. But certainly, yeah. And with that, like, yeah, this is the demo. And we are really looking forward working with the solution provider to make it more impactful and how really this works. And next slide, please, Harry. From who are the members? Certainly, yeah, we are trying to even stop sharing. 1 second, I'll stop sharing. Okay. So this we would like to give in a data because that's kind of a really more value added through IRX, how it should be a decommissioning drug, or maybe like it's going to be a ADR, adverse drug reaction events, and even a data of really where it is being used. All these information, that's our plan to really add more value. It's a value beyond compliance, value really adding more things to our stakeholders. So that's all we are trying. And next slide, please, Holly. And almost we are at the end. And solution providers, thank you so much. And the drug manufacturer, once again, thank you all. Apotex, Sanofi, Lilly, FK. Certainly, we are looking to work with the other manufacturers. Right now, we are in a discussion. So we would like to have more. And if any of you haven't joined yet, certainly we welcome you to join. And certainly we want to make it sure as a meaningful impact and delivering a patient-centric solution. With that, as a thank you all. Thanks for your patience. And certainly I am looking forward to work with you all.
Thank you very much, Swami.